Hi, I'm Dr. Helena Lim, one of the fertility doctor from KL Fertility Center. Today I'm going to talk about what are the causes for infertility. Now we know that 30% of the cause is actually due to the female factors, 30% is due to male factors, and another 30% is both female and male factors, and another 10% is due to what we call unexplained subfertility. Now, for the 30% of female factors, there are numerous causes. The first being the impairment of ovarian function, and that could be due to polycystic ovary syndrome or premature ovarian failure. And also there can be due to causes such as endometriosis or blocked fallopian tubes as well. Now, the blocked fallopian tubes can be due to previous infection, endometriosis, or previous surgery. Now, we also know that things like fibroid or adenomyosis or even uterine polyps can actually potentially inhibit implantation, and that can be one of the cause for infertility. We also know that if you have hormonal problems such as thyroid hormone imbalance, or if you have any pituitary hormone issues, that can again potentially cause you not to ovulate regularly and hence cause you to have difficulty in achieving a normal pregnancy. Now, for male factors, we know that reduction in semen quality as well as sperm quantity are the two main issues causing male fertility issue. Now, increasingly in this modern era, we know that erectile dysfunction is also one of the contributing factor for infertility, as men who cannot achieve arousal or erection, they could not have regular sexual intercourse with their wife and hence causing difficulty in achieving a normal pregnancy. Now, for the 10% of unexplained infertility, we know that it is not without a cause. It is unfortunately a very frustrating diagnosis, is because after all the investigation that you have gone through, the doctors failed to give you a very clear reason why you couldn't achieve a pregnancy. Now, if you leave this couple for another 10 or 20 years, they are not able to achieve a pregnancy. Now, it is not without reason. There are three possible reasons for this unexplained infertility. First and foremost, we know that fallopian tubes are lined with little hairline structures. We know that these hairline structures actually helps to retrieve your eggs, helps to assist the sperm to reach the eggs and fertilize and secretes lubricants to help to ease fertilization. Then after fertilization, this little hairline structure actually push the resulting embryos into the uterus and helps with implantation. Now, we know that if this little hair-like structure is not functioning properly, we know that a normal pregnancy cannot occur. Well, in this world, there's currently no technology to actually assess the functionality of these little hairline structures. We also know that do ultrasound scan and do a blood test for women, we know that we are able to see the number of eggs. However, one of the things we could not assess is actually the quality of the eggs. Now, the only time when we can do an assessment of the quality of the eggs is the time when we do IVF, where we actually retrieve the eggs vaginally and observe it under high power microscope. And only at that time that we are able to know that the reason for their infertility is due to egg quality issues. The third reason is the sperm ability to fertilize an egg. Now, we know that during an assessment of our sperm, we observe it under high power.
If you like our channel, please like, share, and subscribe.